We have with us live on the line the chairman of the Opposition Congress for Democratic Change, CDC USA chapter, Mr. Asifa Tukpah. Welcome.
Thank you for having me.
There are a number of issues ranging and coming out of Liberia, most especially the current Ebola situation, which is affecting countries in Africa, especially with death tolls around those countries, including Sierra Leone, Guinea, Liberia, and Nigeria. Firstly, what's the take of the CDC USA on this entire crisis?
The CDC USA really regrets that this scourge of Ebola virus disease has happened to the Liberian people. We are, working. We have our vice chairman of operations here. He's working to get, container supplies going. And once the logistics are set up, we reach out to partisans to make contributions for the shipment. Mr. Cyrus Howard is working really hard to try to make that reality for the CDC to be represented in terms of supporting the efforts. But overall, I think there are CDCs on the ground who are making their efforts in trying to help government Liberia, combat this. I believe the National Youth League chairman, Mr. Jefferson Koji, offer up the services of 1,000 CDCs to support this effort because we believe that the grassroots awareness is very critical in educating our people, and we are volunteers to assist with that aspect of the fight against Ebola. Today, I don't think the government has taken on, that offer from the CDC to be able to utilize citizens who are, strong in the community, who are respected in the different communities, to be a part of this effort and educate people. So until the government can actively involve citizens in this effort, we think it will still be lagging behind because we are still way behind the disease itself in terms of identifying, tracing, and educating. So we need more of that. If we don't do it, we have a long haul with this disease. Even with the massive international support that may be coming in, we still have a lot of problems in terms of getting ahead of the disease.
Now, with this, you're talking about support for your team on the ground, especially we understand in recent days your party set up a team, like you put it, headed by the task force headed by Representatives Joseph and co-chaired by Senator Peter Coleman. Now, others may wonder whether this team could be up to the task health-wise as it relates to reaching out.
If the team could be what?
Up to the task when it comes to health-wise as it relates to reaching out to those communities. Now you are calling for government to recognize the effort of your party and work with the team.
We don't need government recognition. That's not what I call for. I'm saying we need a partnership. Government needs to embrace the offer we're giving. In crisis situations like this, there needs to be a lot of coordination, a lot of logistics, a lot of hands-on, on management of situations, and a lot of control. And we have not seen that. We have not seen the collaboration across all streams. So we are just asking for more. I think the political parties can really be of strong support to the government of Liberia in this effort. All the different political parties, not just the CDC. So we have established a task force. Joseph, if anybody has been watching, and seriously, I'm really thinking about nominating him for the Nobel Peace Prize because he's doing a heroic effort in pushing the medical healthcare agenda in Liberia. We know that he has been on several fronts, even before Ebola kicked off, to try to improve the healthcare sector. He negotiated for nearly $5 million worth of medical equipment, supplies, and everything with hospitals visiting Hawaii. And the government of Liberia could not step up to the plate. It will be $300,000 to input all those things that we have been coming and who have been very helpful in this situation right now. Secondly, he negotiated for 11 ambulances. Again, Giving them to Liberia was the problem. And sometimes I wonder, I've discussed this with my friend Bianca yesterday, how can I know what ships that fly the Liberian flag don't come to Liberia? But there has to be some mechanism where we can do some kind of arrangement with ships that do come to Liberia and ships that do fly on flag, where it's still a relationship, where in these kind of emergency situations, it can be very helpful to getting materials to our people at the ground. So I hope it's something that they are considering, if they haven't already considered or they haven't already put something into motion, because it's important that we be able to have that ability and that access to get stuff to our country. Our country is not, central, that things can easily get to as you know right now. There's a limited amount of incoming and outgoing people to Liberia right now because of the Ebola virus disease. But to get back to your question, Sir Joseph has been very instrumental in creating awareness. He's actually in the field itself, driving the ambulance and picking up dead bodies and taking sick people to the hospital. So his effort is very laudable. But the reality, he needs help, he needs support. And the CDC has tried to put a task force around him with Dr. Peter Tukpah, who himself is a veteran of the Liberian healthcare system. As poor as the healthcare system has been, and the lack of power movement, the restriction in terms of the Salih family, basically controlling the entire healthcare sector and limiting the input of other healthcare professionals into that, thanks to Mrs. Jenny Bernard, the president's sister, who has a grasp of the entire GFK and what people can do there and what they can do with regards to factoring in their own effort into the Liberian healthcare system. So this Ebola virus disease has just exposed the healthcare system to a large extent, and I think the CDC task force can contribute to that effort with those two top professionals leading it, and the other members of the task force from a logistic, research, and support perspective. So I think it's a worthy cause for the CDC to pursue with that task force, and there also should be additional people being added to that task force who are in the diaspora who can help with coordination. Like I earlier mentioned with the Garba Howard with regards to coordinating, getting items and other stuff on this end.
Now, recently the representative of the Center for Disease Control who visited Liberia made a strong statement that is the situation might go worse before getting better. Is it worrisome for your country?
It's extremely worrisome, especially when the president himself does not take that statement very seriously. The president came off and basically, denounced the estimated 20,000 numbers. There are some people who are even estimating 100,000 deaths. I think that's over-exaggerated, but I'm not an expert to discount people who make predictive analysis using models that have been tested over and over. So, we don't really know. We don't have the expertise as Liberians, even though there are some Liberians who are, infectious disease doctors, medical researchers, biostatisticians, epidemiologists. We have Liberians in all those capacities. Where is the government effort to try to reach to those people to see how we can pull them into the resource effort? They may not be able to physically be in Liberia, but we have a global community right now. There's a lot of technology that enables us to really be able to reach out to each other and assist from a distance. So tapping into those abilities from those that I think make the effort, because why don't we professionally validate some of these numbers before we try to dispute what the professionals are saying? So I just really hope the president can reconsider her position and look to real professionals to do it. Yes, 20,000 is a big number and it's scary, and 10,000 has been allocated to as the potential deaths. But if you look at the rate at which people are dying, and the pictures, we are seeing images, the people on the ground may not be as concerned with, I don't know, but still they are. Because we see people lying on the ground, we see people dying with their body in the street, we see some of the ambulances that, dropping people off at different hospitals. The capacity is not adequate. We need more units and everything. So we are excited right now that the U.S. is bringing a military in. People that should not look at it as military like in the typical conventional sense of military. The U.S. military have a significant number of medical doctors, medical professionals, engineers, and everything. So they should look at it more as a logistical support than an invasion of a foreign army into Liberia.
No. Recently, last week, if I'm just right, Vice President Joseph Boyka talked about the need for the international partners to run into Liberia and perhaps take over this fight. How do you see that? Is it welcoming?
It is extremely welcoming that somebody from the administration will come up and recognize our ability to be able to deal with this situation. You know, as much as, Ebola is not a new thing, we do not have the infrastructure being around since 1976. At the initial onset of this, we did not do our due diligence to analyze all previous instances of Ebola and come up with a comprehensive plan to attack the disease. We did not do that. Even to today, I don't know that we have a comprehensive Ebola management plan in place right now. So that's just our inability. Whether it's because of decades of bad management, on bad systems, or whether it's because of the management effort or lack of management capability in this current administration, the fact is we are not capable of handling this disease and its outreach. So we need more professional people to be at the table, making the critical decisions, giving us the critical and innovative ideas about how to move forward. So I think it was a very wise move for the Vice President to call on the international community. And I think, with the coming United Nations meeting coming up, I think it is the ideal person to come and represent Liberia and maybe reach out to other partners to even emphasize more the need for them to be present, the need for support, especially on a food line, because we know very well with the borders being closed, food scarcity is going to be a big problem very soon. And we need our people to eat. I mean, you can see the starvation in some of the faces of the people who are being, who are Ebola patients. And if they don't get the care, they don't get the, we don't have the healthcare system anyway where these people can be well balanced so that, their system can be hydrated and everything. A lot of them will die. So for us to discount the numbers and not be really seeking help to make sure that we don't get to those numbers, it bothers my mind.
There are people who also disputing the government's recent report of some 5 million disbursement into different areas as it relates to the fight against this Ebola virus disease in Liberia. What's your take on that?
Well, my take is people have no credibility in government. That's been obvious. We've been on the front line on this and trying to solicit. And to the T, everybody says anything you get, don't give it to government. So the confidence in government is full, and government has to build that confidence out of these by being very transparent around this entire Ebola process. And, unfortunately to say, I don't think our people are that difficult in terms of understanding. A government can come clean, a government can set up a website for the Ebola task force, a government can openly say, these are all the contributions we have received, this is what we have spent. This is what we spend it on. This is what we plan to do. If the communication is that effective, I think we'll have more people willing to give, because there's even word around that even the donors don't want the government of Liberia to handle the donations they are sending. And, that's a shame that our government cannot be trusted. But the reality is over the 9 years, they have not demonstrated anybody to trust them.
Okay, with that, pundits believe also that you politicians are using this crisis to make some political gains against the government of Liberia, with recent calls coming from various quarters for Madam Salif to step down on grounds that she can, in the current state, handle the issues of Liberia.
I don't think so. If you look at this, look at the appointment of the tax force. Okay? Mm-hmm. It's obvious to me that the first thing, the president should not be head of the task force. The second thing is the appointed into that position. She didn't appoint experts. They're trying to identify people on a skill level. She didn't even look at or pass the Ebola task force makeup in an area that was successful and look for the skill level, the professional abilities of those people needed on such a task force. So for the president to appoint a task force of the task, I think it doesn't happen. I think it takes away from the effort of those other professionals, especially those who are on the front line. It limits their ability to operate effectively. So I don't think we are politicizing anything. I think the president is politicizing this thing. And to be real, from the onset in March, when this Ebola happened, and the president was talking about she could manage it from abroad on, what should I say, on a teleconference with her Minister of Health, and subsequently then declaring that there was no Ebola. And even when he restarted her expressing confidence in Dr. Bonigali, while at the same time he was saying this Ebola stuff is beyond our capabilities, beyond our range, something else needs to be done about it. I mean, to me, that doesn't speak well of the management ability of the president. She probably does not understand the reach or the broadness of this problem and how impactful it can be, or she doesn't understand the capability of what she has in terms of the leadership, the healthcare leadership, the logistical leadership, the technical leadership that needed, in this situation to coordinate all the different activities. So, I don't think we are politicizing it. The organization, and again to make this clear, the CDC is not calling for Madam Sadi's resignation at this point in time. The organization I'm with is a separate organization which is totally separate from the CDC. It used to be called Better Liberia. That's how the concept was derived, trying to build a Better Liberia. And then eventually, based on reaching out to other people and getting the input, the name was changed to the Global Organization of Liberia that is preparing for a Better Liberia, OBL. And then recently, after we started reaching other people in Liberia, started reaching out to us and discussing this, it seemed more logical, to exclude Diaspora from this team because this is a global organization for all Liberians. So we changed it into global organization for a better and accountable Liberia global. So I hope people understand and separate that in my capacity as the chairman, the CDC is not asking for the resignation of the president. They have not come to that point yet. There will be discussions ongoing, but the CDC has not arrived at that point. For a separate organization I'm a part of, Global, believes at this point the president has not demonstrated the requisite leadership skills. She has condoned an environment of corruption, and she still reposes confidence in some of those corrupt people who have been, openly accused of corruption, involved in corruption, but at the same time not investigated, not indicted, not prosecuted. She also fails as a leader to meet the basic necessities of her people. And we cannot discount that. That's one of the fundamental things of government, to provide the basic necessities for its citizens. The government has not met that level. With regards to the corruption, we saw the most serious audit where they audited 668 of our concession contracts. And for people who don't know, actually there were another 22 contracts that were being requested to be audited that the different agencies of government never provided the information. So at the end of the day, the corruption is extremely heavy in our midst. The incompetence is extremely heavy. The nepotism, the cronyism is extremely heavy. The president continues to report confidence in a limited few, and she doesn't reach to the broad experience that exists in the country as well as out of the country.
Now with all of these you cataloging, is it timely, especially when there is this critical fight? Is it timely for your call, for this group's call?
I think it's extremely timely. The president had the opportunity to move this country from where we were in 2006 to a much better place with all the international support that we got. It's getting long in terms of the billions of dollars we got from the international community. Our own money that was revenue from the public of Liberia. If you start off from the $80 million budget in 2003 to most recently, I think $592 million budget in the last budget year. We have put up several $billion, probably about 9 years, probably like $93 billion of Liberia's revenue over the last 19 years. Plus, if you want to count the $16 billion of foreign direct investment, And I refuse for people to keep saying that. That money was not infused into our economy. It was just a hoax by Madam Sadiq that has come to, buy her in a restaurant. She pretended like 60 million was actually coming, but 60 million was not coming at the maximum. I believe they used across all those 60 million contracts. They actually infused capital into our economy. We probably, 4 billion at most. But all of that 4 billion, what are we looking at? We're looking at generating domestic capital that will be taken out of the country, for these companies to benefit. They're not investing any new money into Liberia. So to say 60 billion of foreign direct investment is just, fictitious. Then, in addition to that, we have the international community, doing budget support and doing so many other projects. If you count their money, it's about $20 billion that is invested in Liberia. And they have not seen anything for it. How many homes have water? How many homes have electricity? How many people actually have access to here? How many of these students are really getting education, quality education? We say 25,000 what? 25,000 field? Was that the number that put the FPP there? So, in essence, the police has failed on every front. So, even within this time period, it's still in terms of handling the Ebola situation. So, somebody who has failed, we know has failed. How can we entrust them to handle critical things and we say it's a very critical time? We cannot. I would take 4 years to the end of the day.
No.
In this situation. And besides that, we need total economic recovery. We are close to the 2003 and 2005 starting point in terms of our economic situation right now. There's a study I'm waiting for, and somebody just gave me the highlight. They projected that about $4.1 billion has been the economy, the amount of the economy has been depreciated by $4.1 billion. And Liberia itself, the impact on Liberia is about $1 billion of economic activity. I don't have the details to know the specific areas, but just off the top of our head, we can see the amount of businesses that have left, the amount of NGOs that have put up shop, the occupancy rate in the hotels, the prices of food, the lack of inputs. So the economic impact is significant. We cannot dispute that. But do I have any confidence that Madam Smith and the current leadership she has around her are capable of taking Liberia out of this hole? No, I don't think so. I think we need a fresh constitutional outlook, and this outlook comes through Madam Sally resigning and Vice President Boyka taking over, and he looking to be inclusive in terms of message, in terms of qualification, in terms of competence, and in terms of experience, to get Liberians who meet those standards to be a part of his government and really help him to get through this effort, because these are going to be very trying times for Liberians for the next 3 years. So we're going to have somebody who has a skill and somebody who is currently failing to be our leader to move us through those processes, and that's the argument we are making.
No. Finally, just to wrap up, what could be your words to Liberians who are currently going through this terror period, those who lost their family members, those who are currently ill, and perhaps those who are also worried about this situation?
The psychosocial impact is huge and tremendous on our people. Look at it like this. A study was done where it was determined that 40% of our people are suffering from post-traumatic syndrome disorder. Most of those people, the child soldiers, the people who went through the war, they were not rehabilitated. Okay? So now they're going through a second major emotional, stressful shock to the system. And people don't understand, not only the people in Liberia who are being affected by this situation. There are people here who are crying every day. People who see those pictures, they will go for these people. We feel it. It affects us. It's really traumatic, and we just need to beg our people to be calm, to not let the anger and the frustration come out. Whatever it is, that's so. Whether it's God, whether it's Allah, whether it's any other belief system that they have, we need to induce those as much as possible to help them get through these trying times. But we need to still be together as Liberians. We need to support each other as much as we can. We need to be very unified on this process. We need to differentiate governance from being unified about a particular cause. Governance has failed us, but the resilience of Liberians, our ability to unite and get behind effort is strong, and we need to feed off on that, feed off on, send our sympathies, our empathies to all those families who are going through this, Ebola situation. I mean, I was on the phone with a lady who took her uncle after her other uncle had passed away to go get tested to EWA, and they refused for her to get admitted there. She went over to the tax force location, spoke with Miracle, she spoke with Tola Yeswa, she spoke with a couple of other people there. The old man, she go back to town in Tukpah and isolate and quarantine himself. So the entire protocol around stuff needs to be revisited. What is telling people, how they treat people who are at their situation. So, our hearts are feeling here. We are trying our best. A lot of people here have family that are infected. Our group, I was visiting funds for Ebola. We had an event about 2 Saturdays ago. One of the young ladies, her entire family, basically her aunts, her cousins, all of them have Ebola. But she still came out to that funds for support to raise funds for us to purchase stuff and pay for shipping. So the commitment is here. People really want to make a difference. People really want to help. We just hope that it can be a national effort as opposed to some people. Like now the accusation of people using the call center money and it not being accountable. Some of the call center participants not being paid. So those are demoralizing information. It's something that the government needs to come up straight and say, we deny this, or for actually use the money, these people will be penalized so and so and so. But you cannot let rumors like that stay out that will deter people from contributing. So we really want to help, want to support in any way possible. We are actually advocating in getting medical materials. We are creating greater awareness, and we want the people to come out of this pool. For the other folks to come out, we got to be unified. And when we're coming out, we need a leadership that will really represent and move Liberia in the right direction.
And how soon do you expect to get this off to Liberia, those medical stuff you talk about?
Well, I can tell you, I would call this person's name, but for example, he was willing to pay for about 4,000 worth of 400-pound kilograms of stuff, right? Unfortunately, because of the shipping situation in Liberia, they double up the price, which took that payment rate out of his possibility. 1. 2, we have negotiated for about $1 million worth of equipment with, World Medical Relief. They are an organization that collect medical supplies and stuff. They just need money to pay for the shipping. We are raising out now. We have enough for more containers that we'll be sending. The problem some people in our organization have again is not sending this stuff directly to JFK. Because even recently, JFK received some material that was used for some other folks, and some of the boxes were already moving. We are hearing that stuff are in the streets and being sold. There's even an issue with Senator Freeman, where supposedly she bought some buckets, that were part of the, relief support. So, trust, where's the confidence? That's the problem we are having. So, to the extent, I don't know what the different, requirements are for anything Ebola related, but we do have identified parts of the ground that we hope to send this stuff to. And I've been trying to reach out to my friend and former schoolmate, the new head of the Liberia Revenue Authority, Madam Tamba, to find out what the arrangement is for sending medical relief stuff to other people who are not necessarily government of Liberia. But if everything has to go to government of Liberia, we don't have a choice. We're sending to government of Liberia because we think our people need them. It's just that we have accountability for the stuff that's been sent to the government of Liberia.
All right, it was wonderful having you on the line, Mr. Azivai Tukpah.
Thanks for having me, and I want to say again, thank you to the Liberian people for showing such a strong resilience. We wish you the best. Hopefully some of you be there by November, December. I'm looking to try to put on the ground. If there's a brief support to give to people, I'm looking to do that and participate in any kind of actual mobilization activity that I can. So thank you.
All right, he's Azivai Tukpah. He's the chairman of the Congress for Democratic Change, CDC USA chapter, speaking on the Ebola issue in Liberia and other national issues.